A young male presents to the orthopedic clinic with the complaints of shoulder pain. Your task is to take history and examine the shoulder joint. So, we will be seeing the shoulder pain in today's session, and my name is Dr. Anand Srinivasan. Some of the points which you should not miss while doing the shoulder examination is to take the history of stiffness, if there is any excessive or restriction in the movements, any weakness or numbness, rough or smooth movements, and most importantly, the neck problems. When asking the history, don't forget to ask the history of a fever, skin inflammation, swelling, trauma, any history of cancer, and any inflammatory diseases like autoimmune diseases, and any motor or sensory problems. History taking. So, it's usual to take the Socrates, that is site, onset, character, radiation, associated symptoms, timing, exacerbating and relieving factors, and the severity. That's the pain score. Okay, so apart from the pain, we need to ask certain other questions which are vital. That is, the pain, if it keeps him awake, okay, or does he awake? His sleep is affected by because of pain, and if there is any stiffness, and if there is a stiffness, during which time of the day is it? Morning stiffness or an evening stiffness? And early morning pain immediately after he gets up from the bed. And also, you need to ask any pain or restriction in movements with regard to certain movements, especially like touching the shoulder blades, combing hair, any sporting activity, any household work, or other activities. Also, not to miss if the pain is present in both the shoulders, and if there is any hip pain, as this might indicate it's a polymyalgia rheumatica. And if he is able to throw the ball underhand or overhand, okay, to approximately 10 and 20 meters respectively, if he is able to lift 2 liters of can of milk, and whether he is able to carry a 20 kg weight sideways. So this indicates if there is any motor deficit. The other associated symptoms with regard to shoulder pain shouldn't be missed is the swelling, fever, injury, any stiffness in the joint as we discussed before, the weakness which indicates motor problem, numbness, a nerve sensory problem, any neck pain to rule out any cervical problems, and if the pain is present in both the shoulders as I said before. The past history, you shouldn't miss hypertension, any heart diseases, autoimmune, diabetic, and thyroid problems. Also, the other conditions you shouldn't miss is the gallbladder or a liver problem, which can be referred to the shoulder joint, lung cancer, such as the pancreas tumor, that can be referred to the shoulder joint, and certain skin lesions like herpes. Don't forget to take the occupation history and smoking, alcohol, drugs, medication, and allergic history. Also, inquire a little about the mood of the patient and how does it affect the shoulder joint in his day-to-day life. In shoulder examination, we need to introduce ourselves, confirm the patient's name, wash hands, explain the procedure. Okay, then like what are we going to do? We are going to move the shoulder joint, and we will be doing certain tests to find out what could be the problem and reassure that there is no pain, and if there is any pain we would be able to stop the tests immediately. Okay, so expose the patient, usually from neck until the waist you need to expose bilateral shoulder joints, it has to be exposed. Ask the patient to stand and confirm the if the patient is having any pain before you start examining. During the inspection, make sure you observe in general. First, observe the head and neck posture, the shoulder alignment on both sides if it is same, and examine the shoulder joints on the anterior, lateral, and the posterior aspects. So, what are the things you need to observe in this? You need to observe the skin, whether there is any redness, swelling, swelling of the any stretching of the skin, any scar, the symmetry, the muscle bulk if it is similar on both the sides, any wasting of muscles, and on the posterior aspects, don't forget to look for the position of the scapula if it is same on both the sides, and any bony abnormalities like kyphosis, scoliosis, lordosis. So next is the palpation. Make sure you wash your hands. Okay, look at the temperature. Check it bilaterally. Look for the tenderness, bony tenderness from the sternoclavicular joint to the clavicle, the glenohumeral joint, coracoid process, and the head of the humerus. Don't forget to palpate the subacromial part and the subcoracoid regions to rule out any bursitis or if there is any inflammation in these regions. Okay, and also uh, palpate over the muscles of supraspinatus and infraspinatus, that is above the spine of the scapula, in the subscapularis, in the anterior aspects, and the long head of triceps and biceps. So don't forget to rule out any muscular pain. And another important thing is don't miss the axillary lymph node examination because this might reveal any cancer which can be present. The next one is the movement. We need to note the range of movements and note any pain. Sometimes the patient may mask, they may do the movement, but they may trick a little bit. Okay, so like bending the shoulders. So make sure that if they are making any other compensatory movements to make sure that they are normal. The scapulothoracic movements, you need to observe this from the back, whether both the scapula and the scapula also moves along with the shoulder joint beyond the 90 degrees. And if possible, try to test it bilaterally and simultaneously. So, what are the tests we need to do? We need to do both active and passive tests, inflection, shoulder joint extension, abduction, adduction, internal rotation, and external rotation. Both the patient needs to be demonstrated, like how they do. Okay, this is active, and passively you just move and feel the joint to find out if there are any tenderness. The other movements against resistance, so these are the abduction, internal rotation, external rotation. So this can be done to rule out any abnormality. For example, the abduction against resistance can be found positive in a supraspinatus test or even in an empty can test, which we will be discussing. The internal rotation test against resistance. So this can indicate a subscapularis problem, and an external rotation can indicate an infraspinatus test. So these are the different other special tests with regard to the shoulder joint, which we will be seeing. So here you can see the supraspinatus. So here the abduction against resistance. Okay, so you need to stand behind the patient, okay, and ask him to do abduction against resistance and find for any pain. Then subscapularis, ask him to do an internal rotation, okay, and look for any pain. The infraspinatus, so here the external rotation against resistance. Okay, so and this is the thoracohumeral region. So this is adduction against the resistance. So find out if there are any problems in this which can indicate the rotator cuff problems. Special test is the rapid differentiating test. Okay, the other one is the long head of biceps test, or it's also called as Ergenson's test. So here what happens is the person flexes the elbow at 90 degrees in pronation, and he is asked to do supination against resistance, and you need to palpate the long head of biceps, okay, and to find out if there is any pain, okay, or if there is any the transverse femoral ligament if there is a problem in this one, okay, which could cause the pain. Okay, so this is Eggerson test. You can look for this in the YouTube. And this is another test which is called as brachial plexus tension test to rule out any problem from the neck as well as the other peripheral nerves which are located. So this test can be seen in this link. So what happens is usually the elbow is flexed at 90 degrees and 90 degrees initially, and the examiner extends the abducts the hand. Okay, then what he does is he flexes the wrists, he extends the wrists. Okay, and then he does a external rotation. Okay, and he then extends the arm. So an exacerbated one is in which the person will be asked to turn his head, okay, and look for any pain radiation along the shoulder. So this can indicate if there is a neck problem or if there is a brachial plexus root problem, okay, or a median nerve injury. So this can find out, we can find out if the lesion is in the neck, and this is called as brachial plexus tension test. The other test is an empty can test. The person is asked to abduct the arms along with the scapulohumeral pain, and he is asked to move his hand against resistance with the arms externally rotated. So here you can see this is empty can. So this indicates if there is any impingement like supraspinatus. And the speed tests. So here the elbow is held is extended, and he is asked to lift the hand against resistance. So this is to indicate if there is any rotator cuff injury. And the nearest test. So here the patient is asked to internally rotate, keep the elbow extended, okay, and we need to palpate the glenoid joints to find out if there is any pain. Okay, so this the exactly how the test is being done. You can find out in the link below. Okay, so with this. Oh, sorry. There is one more test which is called as Hawkins test. So here, what happens is the person is flexing the elbow, and then the examiner holds the other shoulder, and he internally rotates to find out if there is any pain. So this is called as Hawkins test. The other tests which we need to do is the cervical spinal test, the respiratory, cardiovascular, CNS, and abdominal examination, and finally thank the patient and help him to dress up. Okay, so with this we come to the end of the shoulder examination. So this is just a concise one. You need to go through in detail about each test, how it's been done.